Major funding for these broadcasts is made possible by grants from New York Community Bank, Capital One Bank, M&T Bank, Customers Bank, Chase Commercial Term Lending, Perfect Building Maintenance, Genova Burns, Terra CRG. Additional support is made possible by AKA Hotels Corman Communities, Aerial Property Advisors, AVR Realty Company, Bank of America Merrill Lynch, Bank Leumi USA, Briarwood Organization, CBRE, Citizens Bank, Collins Building Services, Colliers International NYC, Connect One Bank, CPEX Real Estate Services, Cushman & Wakefield, DDG, Dime Savings Bank of Williamsburg, Douglaston Development, Levine Builders, Eastern Union Funding, Fisher Brothers, First Nationwide Title Agency, Flushing Bank, Friedman, Handler Real Estate Organization, HAP Investments, Hersha Hospitality, Investors Bank, James D. Kuhn Real Estate Center at Syracuse University, Kilroy Architectural Windows, Madison Realty Capital, Matone Group, Mercantile Commerce Bank, Meridian Capital Group, New Banks, Newmark Grubb Knight Frank, Optimum Window Manufacturing Corp., People's United Bank, Rosewood Realty Group, SJP Properties, Sterling National Bank, Stonehenge Partners, TD Bank, The Continuum Company, the Moynihan Group, and these friends.
Medicare, Social Security, long-term care. I don't know. I don't understand it. Can I qualify? What should I do? I'm 62. I'm divorced. I don't know any of this. I mean, I'm worried about all of this situation. So what have I done today? I've assembled this group of 3 experts to hopefully navigate the explanation of what Social Security, Medicare, and long-term care. My guests, they include Ash Ahluwalia, who is the president of National Social Security Partners, Doug Lubino, who is the principal at Senior Advisors, and last but definitely not least, Rick Lira, who is the principal at the Cambridge Organization. So let's look at it this way. You're the Social Security maven.
Correct.
You are the senior care maven with regard to Medicare, which is, to me, totally confusing after our discussion. And you're telling me that $7.8 billion was paid out in claims last year on long-term care. What is long-term care?
Long-term care is an insurance policy that protects all of our assets. We all work 30 to 40 years to accumulate assets in our homes, our 401ks, our IRAs. And the only thing that protects our savings is an insurance policy that says...
But what if I have enough money? What if I can consider to myself that I have more than enough? Why should I be paying this premium? Look what Genworth did to me and people in New York. They raised the premium by 60% last year.
They did. People, in my opinion, that have over $5 or $6 million of assets really can self-insure and probably don't need long-term care insurance.
What's the statistical of how many people are going to have a benefit in long-term care? You said 7 billion.
Require a benefit? Yeah. The statistics are that 65% of all people that reach the age of 65 will at some time in their life need some type of care, whether it be home care or adult day care or a facility.
So wait a second, Mr. Social Security.
Yes, sir.
Don't we get benefits from you? I mean, not you, the government, on Social Security benefits for long-term care?
Not for long-term care. Social Security has disability benefits, which are very difficult to qualify for. But the Social Security program is a robust program. It covers 60 million Americans, but it's enormously complex. There's over 2,700 rules that govern Social Security. A typical couple has up to 567 filing options. There's very little expertise out in the marketplace.
I mean, nobody,
Yeah.
567 options. And then the bigger question is, we know that there's an exchange, there's Obamacare, and now there's Medicare. So what is Medicare? If we had to explain, Rick was trying to explain the definition a little.
Medicare is going to be the only insurance that a senior person is going to have available to them. Once they are retired, they're no longer working, they don't have their group benefits any longer. Even someone that has retiree benefits, Medicare is still primary for all retirees. So at the point in time when you do retire, you're definitely going to need both Part A and Part B of Medicare.
Explain what Part A is and what Part B is.
Part A is hospitalization insurance. If you worked 40 quarters in your lifetime and paid into Social Security and the Medicare system, you will automatically be available for Part A. It's free. There's no charge for Part A. Part B is everything that covers everything outside of the hospital. And Medicare will cover approximately 80% of everything that takes place outside of the hospital, but you do have to apply for Part B and you do have to pay for it. Most people this year will pay new people going into the system will pay $121.80 for Part B. That's if their joint income is below $170,000. The government has established now 5 different levels. If you're at the highest income bracket, couples earning over $428,000, they'll pay $462.70 each for a husband and wife on Part B of Medicare. So there's 5 different levels that people pay into Part B.
Now, what is Part C or D and the drug plan?
Part C are the Medicare Advantage plans. They're HMOs where you mostly need referrals to use them. An HMO is then administered by a health insurance company. The health insurance company is going to be your primary insurance company, and the federal government is paying that health insurance company to manage your health benefits. You do need referrals. You have to stay in a network situation. If you do get sick, most of them you have an out-of-pocket potential of $6,700.
So you can't go to the doctor. You have to get an approval on the network.
With a Plan C, which is a Medicare Advantage plan, yes. With a Medicare supplement, you have no referrals. You can use any hospital in the United States. You can go directly to a specialist, no referrals. I feel it's the best medical coverage someone can have in retirement is a Medicare supplement.
So here's the question. A person turns 65. Are they entitled to Social Security benefits, or is it 66 now?
Full retirement age is 66, but they may be entitled because it depends. There's so many rules that govern it. Once you reach age 62, you're technically eligible for Social Security, but there's an earnings test. So if you make more than $15,720, every $2 you earn above that, they claw back 1. But if you're not working, you could file early.
So let's look at a person. They're 66 years of age.
Yes.
And they have a spouse, and the spouse is 62 years of age. What do they do? The basic one. I'm not 527 other plans. I know. I'm trying to get the basic plan.
Michael, you ask a very timely question. Because of the bipartisan budget bill that passed last November, one of the great strategies that you're eligible for is called filing and suspending. That has a deadline. If you're 66 or older by May 1st, you're eligible to do that. So in your scenario, the 66-year-old who could file and suspend, and why would they do that? If they file and then defer the start of their benefits to 70, their benefits guaranteed to increase by 32%. But because they filed, their spouse, who's 62, is technically eligible to file for a spousal benefit. In this scenario, let's say it's the wife. If she's not working, she could file as early as 62 for the spousal if her own benefit's less than half of his. Otherwise, she could wait to full retirement age, collect half of his full benefit, and defer her own and max both of their benefits out. So coordinating the benefits is critical.
Now, is there any reduction because they have long-term care? Let's say the person now has an illness and they end up in a nursing home or a hospital.
There's no coordination of benefits. Long-term care insurance is a standalone policy. If one qualifies for benefits, loses 2 of 6 activities of daily living, they will be paid.
What are these 6 activity day of daily living, you know?
Okay, so people think that long-term care you have to be a senior citizen or very old to collect. Most people that are collecting are on an age, but we have a client that went skiing, hit a tree, broke his back in 4 places, both hips, had surgery, and was homebound. So what he lost were 2 of the 6 activities,
Okay,
which
so what
are
are the 6 activities?
inability to dress without assistance, inability to bathe without assistance, inability to transfer from the bed to the toilet without assistance, inability to cook or to eat, loss of cognitive ability, and
Continence.
pardon?
Toilet train?
Continence.
Incontinence, yes. I go into denial on that.
Okay, so those are 6. You have to have 2 out of the 6.
You lose 2. So this particular client was bedridden. His wife went to work, and he brought in a home maid.
Let's take something which is traditional because of the amount of hip replacements that people have. They have a hip replacement. They're unable to go to work, and they also have the inability in many cases to go to the bathroom. Would they qualify for long-term care?
Basically, no. You have to, most companies require an affidavit that says that this condition, in their doctor's opinion, will last at least 90 days to be what we call tax qualified, where the benefits come in tax-free to the insured. So, as an example, I had a hip replacement. I was bedridden for a week and then was up on a crutch.
Okay, so it's a 90-day situation.
It's not what most people consider that severe.
Now let's go back to Medicare. Now Medicare is somebody who's under 60, 66, 65 could get Medicare also?
Only if they're on Social Security disability. And after 2 years of being on Social Security disability, they'll automatically be eligible for Medicare benefits.
So they're eligible for Medicare benefits. We're going to ask how they're going to get on Social Security disability in a minute. But they're eligible for Social Security for Medicare benefits Part A, B, all of these programs also?
Correct, yes. The other thing is just to mention about long-term care. There is a big misunderstanding. A lot of people feel that, Medicare is going to pay for long-term care. Medicare does not pay for long-term care. It will pay for assisted care living with a Medicare supplement up to 100 days. If you're following a hospital stay, such as a hip replacement, they can put you in assisted care living to get physical therapy. Medicare will pay 100% for 20 days. If you have a Medicare supplement, it'll pick up the copay, which this year is $161 a day. The supplement plan will pick it up. So you could be in for up to 100 days covered under Medicare. However, you cannot tell somebody that, in all situations, you're going to be covered. So long-term care is totally separate from anything that
So
Medicare.
what happens if you're in the hospital, in the rehab center for over 120 days?
You better hope you have long-term care insurance. Because
Okay.
you run out of
For
benefits.
your self-insurance.
So you can run out of benefits under Medicare.
Not in a hospital stay. Well, actually, in a hospital, there's only 90 days that you have under basic Medicare Part A. You get a lifetime reserve of 60 days. A Medicare supplement will supplement all the co-pays, the deductibles, and give you an additional 365 days in hospital. I've met people that were in hospitals for 8 and 9 months, which you think of people being kicked out within 2, 3, 4 days, a week in a hospital. But a woman they couldn't diagnose her condition. She was in for 8 months at the University of Pennsylvania. So it does happen that you could run out of hospital.
Fortunately, unfortunately, healthcare, the average amount of days in a hospital, I think, is down to like 3.7 or something like that. It used to be 7 days, so it's changed. Social Security disability.
Very difficult to qualify for. Very difficult. And Social Security's dealt with a lot of fraud and that type of thing. So their antennas are up to apply for Social Security disability. You basically have to have a condition that you're not expected to recover from. So I would say about 90% of first claims get rejected. You may need legal help to help you get through that process. But let's say you get approved. Let's say you get the Social Security disability. You're essentially going to get your full retirement age benefit early, which is very, very powerful. The Social Security benefit technically ends at full retirement age, but all that happens is you switch over from one pool of money, the disability fund, to the retirement fund. So your benefit switches to a retirement income plan. What's important to know, though, that spouse who's disabled has technically filed. And once one spouse files, the other spouse has an opportunity to consider spousal benefits. So you can coordinate off of that.
Now let's look at it. Here's a question. There are numerous articles talking about the number of children who are born today with autism. I think it's 1 out of 100. It used to be different. Autism is a condition which could be debilitating to the point. So a person who has autism, can they qualify for Social Security?
That is a very difficult,
Okay, so it's a
very difficult case right now.
Okay,
Yeah.
so here's a person, and I'm looking because I remember one of my former colleagues. His son was autistic. The guy lives in a group home. He can't really. He works part-time, so he has wages, so he can really qualify basically for Social Security. But then there's the question of Medicare also.
Normally, we see people leaving their children on their health insurance up to age 26. At age 26, if the child is incapable of self-support, they could file for Social Security benefits at that point in time. We've had children go on Social Security at a young age, and we're able to get Medicare benefits.
Now I'm going to complicate this even greater, okay? Because I want to talk about people don't realize that if you were married for a period of 10 years, I believe, and you get divorced, you have the capability, you could be the husband or the wife, of collecting benefits on Social Security. Explain that to me.
It's really quite incredible. Divorced couples have more options than married couples because married couples, only one spouse can collect off the other. In a case of a divorced couple, both spouses technically have an opportunity to collect off of each other. But you're right, there's certain stipulations. Your marriage had to last for 10 years. You have to be divorced for 2 years. You both have to be at least age 62, and you have to be unmarried. The interesting thing about Social Security is there are so many exceptions to the rule. So technically speaking, if you're divorced, you can collect off your former spouse and vice versa. But if you remarry, you lose those options.
So it sounds like to me, we were talking about the situation before. You have the guy who's 64 years of age. He has a girlfriend who's 62. They're both divorced over 10 years. If they get married, they lose their spousal benefits from the other side of the family?
Not necessarily, because there are general rules and then there are exceptions. You know, I joke that there's 2,700 rules of Social Security. I think there's 6 and 2,700 exceptions. And one of the exceptions is if you both reach full retirement age and you're entitled to collect off your former spouse, if you remarry then, you both get to keep your benefits off of your ex. It makes no sense, but that's the rule.
Now, are there any rules that relate to a divorced couple or a divorce on Medicare?
It's the same situation. If you're married for 10 years, you could collect on your spouses. If you didn't qualify for Medicare on your own because you didn't work enough quarters in your lifetime, you could then get your Medicare benefits off of a spouse after 10 years of marriage at a later date if you're divorced.
Now, do you have to go in? Do you apply? Does the spouse apply?
The spouse doesn't even have to know you're collecting these benefits. You just go in and apply for the benefits, and they'll have records of it.
Could be collecting Medicare benefits, and the spouse could also be collecting Social Security benefits, and the other partner wouldn't even know about it?
They wouldn't need to know about it. It doesn't affect them. They're both eligible. In fact, they're not involved in that decision process. You go into Social Security, they look up your former spouse's benefit amount, and they start sending you half unless one thing happens. If they die,
let's
you get all of it.
Let's get back to long-term care. When you get long-term care, do you have to pay taxes on it? Does it have an effect on Social Security?
It has no effect with Social Security. Under New York state law, any couple or individual that buys a policy is entitled to a 20% New York State tax credit. So if your premium is $3,000, you're going to get a $600 dollar-for-dollar tax credit on the filing of your New York State
But
return.
it's only in New York State. Now, if you get benefits in New York State, since the government, if they gave you a credit, they say, I have to recoup it. Do they recoup it?
No. No,
Now,
they don't.
How difficult is it? Because it sounds rather easy. We're not saying how easy it is, but basically, to get Social Security, you go and apply. You may not know what you're doing, but you apply. To get Medicare, you go and apply. How difficult is it for someone today to get long-term care, especially since benefits, the claims have been so great over the period of time that insurance companies are saying, hey, I'm not going to do this,
It's a great question. The underwriting years ago was very simple. An individual would fill out an application, the underwriters would look at it. Most companies today, or majority of them, are requiring a blood test and a urine specimen because claims have been accelerated in such a rapid manner.
Now, a blood test and a,
Urine specimen.
okay, but not an examination?
No, what happens is a underwriter will look at your application and will determine the medications you're on and your history. If they want more details, they'll send to your physician for a report.
Now, prior to the show, Ash arrived early and he told me he just came back from North Carolina. And here's an interesting thing, and I hope his brother, who is in very good shape, last week found out that he had to have a triple bypass, okay? The triple bypass, he wasn't sick, he had nothing wrong. Let's say, I think there's an incontestability of 6 months normally under insurance? Or
It's 2 years.
2 years, okay? So his brother applied 2 years ago for long-term care, okay? Your brother's 59 years of age, you were saying. Do you have to be a certain age to get long-term care benefits?
No. To get the benefits, no, as long as you have the policy.
No,
To get a
okay.
policy.
So here's the circumstance, because now I want to illustrate with something over here. Ash's brother, 59 years of age, buys a policy at the age of 56 for long-term care. He didn't know he had any condition, okay? Even though there was a genetic, a history in the family that there was heart attack, but,
He was healthy.
he was healthy. Okay.
There is no penalty.
So he can qualify for long-term care if he meets 2 out of those 6 tests that you said.
Whenever he would get
Okay,
sick,
fine.
but they can't come back and say that they want to raise
No,
his
I'm not.
cost.
No, I'm just trying to see the identification of an actual case. So here is a person who, if they had the policy, and 2 conditions continue for a period of time, that person could collect benefits under long-term care.
Yes.
Now I'm going to relate it to the other areas of the people over here. Okay. Now your brother, can he qualify to get Social Security benefits?
Well, he's 59. If he was able to qualify for disability benefits, which has to play itself out, then certainly he would. But the likelihood is he's going to have a full recovery.
Let's say he was 62. Let's make it more. He was 64. Can he?
Well, at 62, he can apply for retirement, Social Security retirement benefits. You can apply for disability at any time.
Okay, but I'm
you have to
talking
qualify.
about Social Security retirement benefits.
Retirement benefits? No, he wouldn't be eligible until he's 62. Yeah.
Now, what if his wife was 66?
For her own benefits?
For him?
Well, she can't collect off of him because he would have to file, and he's not going to be able to file till he's 62.
Now, let's get to the question over there. Now, he was working for a company. Mm-hmm. Here's what happens. He was working for a company that had a group program of over 20 lives over here. He leaves the company later on because he's not healthy enough to stay on that. And we have to make him over 65 or over 65. He then can get Medicare?
Yes, definitely. If he is retiring after the age of 65, you need to go to Social Security with a form that they require just to verify you've had group health insurance since you've been 65 years old. If you're first turning 65, you can do this online 3 months before you turn 65 and you want to apply for Medicare A and B, you can enroll right online on the Medicare.gov or the SocialSecurity.gov website. But again, if you're over 65, leaving a job that you've had group health insurance, you do have to prove to Social Security so you do not get penalized for not having Medicare when you should have taken it at age 65.
Here's a big question. You're with a company, you're a small company, but you don't want to go into the small group, so you go into the qualified plan? What's that qualified group?
The partnership?
Yeah, the partnership where, like ADP, they buy group insurance for
Oh, okay.
PEOs, yeah. A PEO would be with
PEO.
a PEO. So, but as a PEO, it's over 20 employees. So that person, even though they're in a small group, is in a PEO category. So they're considered that they're in a larger group.
The group health insurance is a large group plan.
So if a single employee joined the group over like that, they're considered being part of a large group? Let's say
I don't believe a single employee can join
they
one of
can't.
those groups at all.
They can't.
what are certain things that somebody should do, especially each and every day there are more people becoming boomers, okay? What do they do with regard to Social Security? What do they do with regard to Medicare? And what should they do with regard to disability?
I think it's critical once you get to age 60, you review your Social Security benefits.
Age 60, you said.
Yeah, age 60. Because you could retire as early as 62. So you want to give yourself a head start in reviewing your retirement planning options. Social Security for most people today is their only pension. 90% of pension plans are gone. And so for a typical middle income, upper middle income couple, it could end up paying as much as over $1 million in retirement benefits. So it's
Should
critical.
a person go to Social Security or apply online? Because from what I'm just hearing, if you apply online, you probably have no idea what's going to go on because the difficulties.
No, you need professional advice to examine Social Security. First of all, Social Security is prohibited from offering advice. You need to integrate it in with your overall retirement plan. It's a very complicated program. You need sophisticated software. So look for a professional who has specific expertise in Social Security planning.
Medicare.
The most important thing is deal with somebody that specializes in Medicare. Too many people, even accountants, financial planners, a lot of agents don't understand Medicare and have given out bad advice to people. So deal with somebody. When you approach age 65, you have to make a decision. Either you have to have Medicare at age 65, or again, if you're still working in a company with 20 or more employees, you can stay on the group plan, or if you're covered under a spouse.
But it doesn't hurt to take Medicare Part A no matter what.
Doesn't hurt to take Medicare Part A. You'll get a Medicare ID card with Part A on it. It'll be secondary to your group health insurance. Very seldom will you be able to, get any benefits from that Part A, but you will be filed and you'll have your
And
Part
then
A.
you won't be penalized later on.
The penalty comes from not applying for Part B when you're supposed to take Medicare, and that's when the penalty can hit. It's not the Part A penalty; it's a Part B penalty.
Disability, long-term.
I want to thank you for bringing the experts together because it is so confusing, each piece of this. And I think as everyone has said, you need to go to a specialist. If you have cancer, you go to an oncologist. Social Security, Medicare, long-term care are confusing. And you need that professional advice.
But unfortunately, what happens is too few people take advantage of this. It's like estate planning. You hear about estate planning. How many people don't have a will? How many people haven't taken all this into consideration? And I think it's a general comment that people say each and every year you should wake up and go over your health insurance benefits, your estate benefits, your retirement benefits, your insurance benefits for your home, for fire insurance, auto insurance, and everything else, because it's truly a maze. And the biggest maze, I think I just had discussion today. And I'd like to thank Ash, Doug, and Rick, and I'll see you next week.